Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, persistent feeling of hopelessness.
Hello viewers, welcome to this week's episode on Health Watch on Advent Cable Network Nigeria. I am Angela Nweze. The use of medicine is like a double-edged sword. On one end, you use it and you have a satisfying relief and have nothing to worry about. However, on the other side, when used inappropriately, there could be negative consequences that may even result in fatality. The World Health Organization in 2012 estimated that more than half of all medicines are sometimes prescribed, dispensed, or sold inappropriately, and patients on their own fail to take medicines correctly. The overuse, underuse, or misuse of medicines result in wastage and widespread of health hazard. On the program today, we shall be discussing the dangers of misuse of medicine, especially in Africa. My guest on the program today is pharmacist Salamatu Orakwelu. She's a fellow of the West African Postgraduate College of Pharmacists, and she is also the chief pharmacist at Chiva Specialist and Urology Center, Zone 3 here in Abuja. You're welcome to the program.
Thank you.
It's good to have you here.
Good to be here too.
And thank you for bringing your lovely smile to us.
Thank you.
You know, I don't normally have lots of female guests on the program, so when I see one, I'm really excited. Lots of men all over the place.
Thank you.
All right, thanks for coming.
So
we want to discuss the misuse of medicine, you know, and really, I know the world is crying out now. You know, and very soon we'll be celebrating the World Pharmacist Day, and everybody's crying out now. Oh, we're having problem. The medication that's supposed to be doing us well is now becoming a problem. You know, but we'll talk about that as we progress. But first of all, I want to understand the difference between drug abuse, you know, which is what almost the umbrella, the caption, everything, it covers everything, and the misuse of medicines that like we're discussing today. Yep.
Okay, well, before you talk about the misuse and abuse, I think we need to know what a drug is.
Okay.
And a drug, in simple term that one will understand, is a chemical substance that is used to treat, to cure, to prevent, or used for diagnosis of a disease or well-being. Like you initially pointed out, it's a drug. The drug that we're supposed to use for our own benefit is now causing harm.
Yeah.
And that's where area of misuse comes in. The misuse and abuse. And I think there are words that people use interchangeably.
Yeah.
But the basic thing there is the intent. I think that's the thin line, the language, the thin line, the difference between them. Because for misuse, the person, the individual actually want to use it for a positive, to be able to treat or prevent an ailment, but not using it rightly. While for abuse, there's this urge, the desire to feel good, to feel high. That's basically why people abuse drugs. And when you talk about misuse come in the sense of why you're using the drug. You're using the drug outside the legal or medical guideline.
Okay.
That is use of a particular drug that is not in accordance to the acceptable legal or medical guideline. You're already misusing it. Why do people misuse drug? Some we misuse drug because, at times, when you talked about Africa, misuse of drug most basically comes in Africa. It could be as a result of financial constraint. You understand? Resources, will I say, caps everything. My child is not feeling fine. You saw your neighbor, your neighbor's child was down with fever, cold, similar symptoms, and you now feel okay because she used a particular drug. You, without going to the hospital, without the right diagnosis and prescription from a a health practitioner, a physician, you just go buy the same drug and use. But you find out that at the long run, people spend more money than what they would have even gone at that initial stage.
Yes.
Okay, go to the hospital, see the physician, run some, laboratory tests be run, make the right diagnosis, then they give you prescription and you go get the drug. I see you're not feeling fine. This is the drug I just finished using.
Yes.
Can you just use the remaining? And people misuse drug because the side effect of certain drug will even make people start using drug and don't complete it.
Yeah, that's true. And then that's even a problem on its own.
Yes, some people will say, okay, the last time I had similar symptoms like this was what the doctor gave me. And if you go, because you're not going to see the medical doctor, you've not gone to the hospital, seeing a physician, go through the right process of getting that prescription, and then go to a pharmacist to get your prescription filled, you're misusing drug.
Yeah.
Then when you come to issue of abuse of drug, people abuse drug. Will I say, I want to say psychologically, we have the social aspect, and we also have the environmental aspect. For the psychological aspect, we go through a lot of stress, mental stress. People go out of pressure, they take that drug to relieve themselves of that pressure. The social aspect, people want to belong, peer pressure, peer pressure, and even family history is still, because for people that still, you have parents, some people start using drug at a very tender age, and before you know, they get used to it. And when you come to the environmental aspect, accessibility to this drug again leads to abuse of drug.
So that's in the drug abuse aspect.
Yes, the drug abuse, accessibility to this drug. You understand? You go, because you are able, we don't have stringent laws here
on medicines,
on medicine. You can just walk, even when we're trying ethically to regulate from the council, the pharmacist council is trying to regulate the use of some ethical product, but you still find out that there are some laws that are not properly being adhered to, and you find out that because they can have access to this product, and also we have cheaper ones. Those are those days that we used to have this show before they even started. Drug abuse became the country declared war against drug abuse. You find out that people could access most of the drug that is being abused at a very low price. And why is that possible? Our borders are porous.
Okay, so that explains the difference. You have the drug abuse, which is, I think that's even a whole discussion on the drug abuse, because the state of the drug abuse now in the country is especially it's alarming
and
now.
Ironically, when you talk about drug, it's not just drug. I think it's even more appropriate to use substance because people now move away from just the drug. There are other things people are abused to make themselves feel high, and they get this, which elicits the same effect of it that affect their. You see, another thin line between drug abuse and misuse. From misuse can lead to addiction. For the misuse
can lead to addiction as well. Yeah.
By the time you misuse drug, and you now know that okay, you're already misusing this drug, and you have the ability with education to be able to stop. But for drug abuse, you are aware the danger this is causing you,
and then you take it,
but you cannot stop it. That is where addiction has actually set in. You can't stop it. You know it's affecting you. It's affecting you mentally. Your whole is affecting you. Your health is being affected. Your family is affected. Your finance is affected. Everybody around you, all around you. But you don't even care. You don't care because you cannot stop. That is where you want to say, okay, this person at this particular point in time is abusing drug because addiction had set in.
All right. So now, just to help us to the misuse of medicine, because I love the fact that you brought in the drug abuse, which is an area that is really sad, But in the misuse of medicine, let me try to understand how medicines work on their own. Because sometimes you see somebody has maybe some aches in the head and say, I have headache, and then they pop in some analgesic and they say the thing will go there and stop the medication. Is that how it works? Is it when your tummy is paining, you have stomach pain and you just pop in some pill and you get better? Say you entered my stomach and it just burnt all the things that were causing the pain.
Well, this is where the issue of pharmacokinetic and pharmacodynamic come in. You understand? Because when you take a drug, it goes through process.
Okay, so it doesn't just go straight to the place. All right.
No. Well, there are some. It depends on also the routes. There are some that go straight to the bloodstream and start their effect.
That's when you inject.
When you inject,
okay, or you put intravenous. I think IBS.
They're all injected. You either have the intravenous, the intramuscular, or the subcutaneous. They all go directly. You understand? It doesn't go through the process of, because the other process is we have to call absorption, metabolism. You understand? It's actually when it gets to, and some drug depend on the route, like we've pointed out. When it comes to issue of metabolism, some drugs are active in their metabolized form. When they are not metabolized, they are also active. You have the active metabolite, and the one that is not active is excreted. So it goes through that process, and which brings us to issue of, okay, I know the next question you want to ask, since this drug goes through process and you have to take it orally and it goes to your stomach, what role is food
yes
playing
in that? Because I'm thinking, because so in the summary now you take, like you said, the routes, some go directly. I know the fastest is when it goes to the vein. It just quickly, if
pass through the bloodstream,
it goes straight. But if it's the one you take in, you digest it, and then from there you can gain access to the bloodstream.
It will be metabolized. Once it is metabolized, and the main organ of metabolism is the liver.
Oh, okay. So I don't think it's the one. Yes, I know that because I did a bit of it. But okay.
So from there, before you now find out that the one that goes into the bloodstream goes into other organs. Then the distribution aspect is also there. You understand? You have the distribution aspect.
So the liver is very key.
It's key.
It's
basically the main organ of metabolism.
Oh, right. Okay, we'll talk about that liver. We'll come back to that liver, but let's talk about the food. And just as you started pointing at that, the next question I was going to ask, you took it from my mouth. So why do we have to use food to take medicine? I mean, can't I just wake up in the morning, use water and...
Well, you see, when you talk about it, when you are coming to that liver, excretion is also there. If you want to talk about excretion, the kidney is there. When it goes to, once you talk about metabolism takes place. They depend on the kind of drug that one is taking. But like you pointed out, it's like a whole topic of its own. So organ of excretion and metabolism, the kidney is there, the liver is there, and.
Okay. So if you want to, if you take with food. So the food you take helps you, the absorption process of the medicine, just coming back to the food and medicine.
Yes.
There are two questions I'm going to ask for them. Let's finish this up for food.
Okay, you see, for food, there are drugs that the presence of food will enhance the absorption. While the absence of food will enhance the absorption or inhibits the absorption. You see, for food that needs an acidic medium, you understand the presence of food, you understand acid is released in the stomach. So for drugs that their metabolism is enhanced in acidic medium, once you have food there and a proteinous food, it will reduce the metabolism and even the absorption of such particular drug. And there are other drugs that in an alkaline medium, you understand the absorption. It's a fatty medium, basically. In the presence of a fatty meal, we enhance the absorption of certain drugs.
So it's not every drug that
It's not.
it
require a particular
kind of food.
No.
So which means it's important to actually ask.
It's very, very important when you're taking, and it's not just food alone. There are some drugs that if you take 2 of them, and this is where the issue of inhibition and potentiation comes in. When you still follow that pathway, you want to talk about the process a drug follows for it to get to, when you take a tablet, for it to get to where it's going to work, it will work. So they are all processes that it takes.
Okay, it's a process that it takes. Okay, yeah. When we come back, we'll discuss. Is it proper to use fizzy drinks to take fizzy drinks to take your medication or to take treatment, and then we'll start to talk about misuse of antibiotics. Okay. We'll start dwelling that when we return from the break. Right. So, all right, viewers, we'll be right back with more on the program. Stay tuned.
Use the say are the leaders of tomorrow. What do you think will happen to the next generation if these youths are not trained for tomorrow?
This program promises to be so enriching, wonderful, fun and interesting.
We are a chosen generation. We've been called for to show His excellence.
A particular set of people that has a demarcation. Never ever think you are a mistake.
We are a chosen generation.
The light shines in the darkness, and the darkness cannot comprehend it. That is a legacy.
Has given me, for I know who.
Joshua and his generation saw the miracle. They walked through the Red Sea.
Whenever you introspect, there are deep desires of the heart that you wish you could do.
Where He says I'm at, I know who I am.
There are lots of distractions for young people around the world right now. If you don't engage them in the church, if you don't support their talent, nature abhors vacuum.
I am believing God that the Lord will move again, once again, in our time and in our generation, and our eyes shall see it.
Welcome back, viewers. Before we went on the break, we were discussing misuse of medicines, and my guest is still pharmacist Salamatu Orakwelu. Thank you very much, ma. Lots of information, lots of good knowledge coming out here. So, we want to discuss. I want to ask a question first before we start talking about antibiotics. Is there any problem with using fizzy drinks to take any form of medicine? Or even though fizzy drink, maybe all these sweets, very sweet drinks. Sometimes people just take a can of fizzy drink and pop it in your mouth. And is there anything wrong with that?
Well, you see, like I told you, it depends on the drug, because as a patient, you really don't have the knowledge of which drug you're taking.
Okay.
And there are, like I earlier pointed out, there are some drugs that the presence of an acid in the stomach enhances the absorption of such drug. Okay. Once a drug is in the right medium, you find out that it's well absorbed and distributed. And at the end of the day, you get the desired therapeutic outcome, if efficacy that is required. But if you don't, because you don't have the knowledge of what that drug or the medium which that drug work best, the best liquid fluid to use in taking your oral medicine is water.
So because of being careful,
yes, there's usually interaction.
There's usually interaction.
And when you talk about interaction, drug does not interact only with drug. We have drug food, drug herbal medication, drug disease situation, because there are some drugs you take, yes. Let me give you an example. For somebody, you take paracetamol. Your paracetamol is supposed to heal you of your pain, right? If you give paracetamol at a certain dose, and depend on the, will I say, the health status of such individual, for somebody that has cirrhosis, that's liver, has problem, cancer of the liver, it's like pouring an acid on a wound.
Oh.
Yes.
Oh, I see.
Yes. So
and sometimes even the person taking doesn't even know that you are.
But that is the more reason why you should not go misuse drug by self-medicating. You see, self-medication is another means of misuse of drugs.
Okay.
Because you feel you have knowledge, and you think what is even enhancing the use of, will I say, more of even the use of this drug, misuse of drug basically is the internet. There are some knowledge you feel, you go read. If you're not able to digest and understand that information, it will be injurious to your health.
Yeah. Okay, I like that. So it's because you're not sure of the interaction of the medicine you're going to take. The best thing is take water. Does it matter if it's cold or?
Best thing, listen to your pharmacist.
Pharmacist, okay.
You go to the hospital, see a physician, do all the laboratory
and ask questions. Yeah.
Ask questions.
Ask.
When you want to come to issue of asking questions, there's this patient bill of rights that is ongoing. I think it was a bill of rights which other institution or other bodies, American Hospital Association, came up with this patient bill of rights, where it is the right of the patient to know what
they are taking,
and you are supposed to make the information available. Ask any question. That's part of their responsibility. Their right to ask, and their own responsibility is to let the physician or whosoever is attending to them all the necessary information. Because if I don't tell you what their reaction, this comes to issue of will I say allergies?
Yeah, okay.
Allergic reactions. People, there are certain allergic reactions that some drug will elicit, which ordinarily somebody taking it for me, let me even use myself for an instance. I don't take paracetamol. If I don't give you that information and I'm very sick and it's not documented on my file, you give me, you just see me swollen all over.
Oh, right.
Yes.
So,
and it still boils down to an issue of treatment is individualized. And that is why you don't need to, because
somebody else,
patient A or your eldest sister, your brother took a particular medication, or your parents, they did well with it. Yes, I know when it comes to genetic predisposition, you could say it's in the family lineage, but you still need to get proper diagnosis and get the right medication. The right
I hope all the our viewers are watching, because I love what you're saying now. Very, 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 very important. So medical reaction or medicines, reaction of medicine, they are individualized.
Yes.
So you cannot use the reaction on another person to conclude for yourself.
There's a general one.
There could be a general one, yes.
The treatment basically is individual, and that's why you see, as pharmacists, science is evolving.
Yes.
Before, emphasis was more on drug, but now it's more on the patient. And this is where pharmaceutical care comes in. And further, we're just going beyond dispensing drugs to our patient. You say you educate a patient so that that patient will make an informed decision that will improve his own quality of life. Because the essence of going to assess care is what? To improve your quality of life. If you're not healthy, you will not be productive.
Of course.
Are you getting me? You will not be productive. It is not only you that will suffer it. There are other people, relatives, caregivers, and it starts, you're just trying to manage a particular ailment. Because of this misuse of drug, you could get a very serious anaphylactic reaction that will even leads to death.
Wow.
Yes. Like Steven Johnson syndrome, where I'm telling you about issue of giving appropriate information, or don't just misuse. You cannot say, okay, somebody had malaria and he used sulfadoxine pyrimethamine, which is Fancida, like the normal Fancida. Do you know somebody that reacts to sulfonamide takes that? Some of the reactions are not good.
Wow.
Yes. So we need to be careful with issue of this misuse of drugs.
So number one, your treatment is individualized.
Yes.
Take it, even if all the medications they have general one, take it that this is me.
Yes.
Just as you said, it's now to focus on the patient.
Yes.
It's yourself.
Yes.
Then ask questions.
Ask questions.
If the person is not responding to you, just shift to someone else. If possible, if you can do that.
It's even your right.
It's your right, yes.
You need to demand for it. It's your right to ask any question. No question as regard medicine. It's, will I say,
a foolish question.
A foolish question. If I'll be
because it's
allowed
your
to.
life. I have my younger brother. When we go to the hospital, when he's not feeling well, sometimes we are impatient to stay with him because every medicine he would ask, well, so what is he supposed to do?
Yes. He's right.
So should I take him morning, afternoon, or say evening? He will write it down.
Yes.
So he will follow. He's ready to follow, and that's why he gets well faster than all of us.
It's not even issue. You know, there are times they write, take this 3 times daily. It's not just 3 times daily. Another area people misuse drug is misdose. A drug has been prescribed for you. You've been told to take the drug 3 times daily. And you know we have 24 hours in a day.
Yeah, that's what I wanted to ask. So how do you determine 2 times, 3 times, once a day?
Like for me, the usual practice is not just writing 2 times. You specify the time. It's even part of our SOP. That's our standard of. It's even our procedure. Of labeling. You have to label appropriately. If a drug is supposed to, the essence is, you know, I talk about pharmacokinetic. When you talk about pharmacokinetic, the numbers of hours that drug will stay in your body. For a drug that is taking, will I say TDS 3 times, that means the half-life in the body is 8 hours. So by the time you, for a drug that is 8 hours, you're expected for it to cover you around the whole day. You are supposed to take it for 8 hours. By the time you divide 8 by 24,
you get 3. Okay.
For those with 12 hours, you take morning, and that's why we always specify take this drug 8 a.m. in the morning and 8 at night. Some people will say, okay, they said I should take it 2 times. I should take it 3 times. The drug you're supposed to take 8 in the morning, you now remembered around 1 and you took. By 3, you go and take the 3rd one, so that you will meet up with the one you're supposed to take at 8 in the night. And while we're talking about the patch route that drug follows, you see, the essence is that for a drug that is supposed to stay in your body for 8 hours, go through the metabolic process and absorption, and you don't do it. You find out that especially drug which their side effect, there are some drugs that have narrow therapeutic index. That's to tell you that they are the minute quantity, very potent, but their side effect is very, very high. You just need a very little dose. So now the concentration of a particular drug, you're supposed to take a particular drug down, the effect will wear off. Even if it's going to have any side effect, it will wear off within that 8 hours.
Yes.
Your body must have absorbed it. Now you're taking it, you're taking like 3 doses within short intervals. So that I found out, I said, this is what was prescribed for me. They prescribe, this is what they say the drug would do in the body, but you've not used it appropriately.
Oh, I see.
You have not
and that
used
can be really dangerous.
Yes.
Really, because if you have a medicine that's very potent and you need 8 hours, if you're taking it for 4 hours, you're in trouble.
Yes, the concentration
in your body
will be high.
Yes, yes. Oh, I see. This is very, very key. This is very key. That's talking about the timing,
the
duration for medication, and I think that's close to what is the problem with antibiotics, isn't it?
Yes.
That
it's not just antibiotics. Basically, all drugs.
Okay, let's talk about antibiotics and why it is becoming.
You know why I say it's not only antibiotics?
Yes. Okay.
I just had a flashback of an elderly woman was not feeling fine. You know, most elderly people have comorbidity. Comorbidity in the sense that they just have only one ailment. They have hypertension. They are
diabetic. Yes.
Dyslipidemia. The cholesterol is high. So they now give her a particular drug, and for we blacks, there's a particular drug, diuretics, to reduce the salt, you understand, like reduce the fluid volume
in your body.
In our body. And they now gave her, before she got to the hospital, her blood pressure was quite high. And one of those drugs that were added for her had a diuretic. and it makes one to pee.
Yeah.
The person that dispensed to her, which also brings us to meeting a pharmacist. Let a pharmacist be the one to dispense and educate you.
Not dispenser.
No.
You know, there's some people that just stand over the counter.
And she was not, and this issue of ask question and educate, the pharmaceutical care aspect now comes in. You're not just giving the person the drug, you're also counseling. You're counseling the patient, you're educating the patient, because it's partnership. If that patient does not do well, and the pharmacy, mind you, mark you, is the last point of contact. You might have gone seen the physician and gone to the lab, gotten the right diagnosis. If you're given drug and you're not well informed, you refuse to adhere to the instruction given, or the therapeutic regimen that has been, given to you. You find out that work done is
nullified.
zero.
In fact, everything has,
So this elderly woman did not take the drug at night, in the morning. Since it's something that's going to make you pee, during the day you pee, then at night you'll be able to sleep and your blood pressure will come down. And what are we talking about, this blood pressure? When the pressure is actually high, there are other factors that will contribute. And do you know, for the first day she took it, she didn't sleep. The second day she took it at night, she didn't sleep. Third day she now carried the drug, went back and met the doctor, said, before I came, my life was better. I know I was having headache, but I was sleeping. But this time the headache is worse and I cannot sleep. The doctor now said, Mama, what is the problem? How are you taking this, your medication? I now discovered that the diuretics she was supposed to take, the antihypertensive, basically, I always advise my patient to take their antihypertensive during the day, because this is supposed to bring down your blood pressure, so that in case you're noticing any symptom outside the normal, you will seek for help. But if it's at night and the blood pressure is so low, you will not know, you'll be able to, but during the day, and say, the drug is not that the drug is not working. The drug is okay, but how you're taking it. It took a lot of persuasion and counseling. He was referred back to the pharmacist, and the pharmacist this time around counseled her, educated, and even followed her up, and so that she started taking it the way she now says she's okay now. That side effect was no longer there. So it's also very, very important, the right of a patient, that you should do what? Ask question. It's not just the duration alone, you understand? The frequency, rather. Now we're talking about the frequency, the duration. Maybe when we come to antibiotic, you now see where both antibiotic and anti-malaria, where issue of not adhering to therapy. Now we've talked about frequency. Frequency is the number of times. The duration is the complete treatment regimen.
So when you go to a pharmacist, because I'm going to go on a break now, when you go to the pharmacist, or your drug is being dispensed, your medicine is being dispensed to you, you see this 11-11-11. Don't just take it.
No.
Don't assume morning, afternoon, evening, because you don't know when morning, afternoon, evening. Ask your pharmacist. So, auntie, uncle, how do I take it? What time do I start? I'm going home now. It's 8 p.m. How do I start? Isn't it? That's appropriate. That's the right thing to say, to ask, isn't it? And then they should be able to tell you, see when you take it, see when you take every 8 hours. And when they put every 8 hours in between, count it, your 8 hours and start your treatment. I think I'm in order in what I just said.
You see, yes, you are in order. And at times it's not even the first of the pharmacists or even the healthcare giver, the healthcare team. At times some patients feel they have the knowledge, they already know.
So they don't even ask.
They don't ask, they are in a hurry. Just give it to me, is what I've been taking before.
Okay, we're going to go on the break now. Viewers, you don't need to play with your health. You need to stay back and hear the other parts of this discussion today. We'll be right back.
My name is Titus Oladipo Adeboye. Jesus to me is reality.
So when I tell people about Jesus, I'm telling them from my own experience of him touching my life.
And I made up my mind that I wasn't going to get annoyed about anything from anybody. With the result that I said to my God, please give me the grace to forgive those people that have wronged me. And he gave me the grace.
If I'm battling with a situation and I don't have peace with it, I know I have not reached the solution God wants me in that is. The fact that the word of God, the scripture that I imbibed, made me wise unto salvation is the greatest testimony that I can give.
God is our help. He's our guide. And our defense is sure.
Which time your name is called, it emphasizes where your loyalty and your commitment is. And I believe that my commitment is unto Christ, is unto God the Lord.
But it has taught us to trust God that even in a death situation, we should call upon Jesus and he can change our story. The life you live is the best gospel you can preach.
The Journey is a program that features men and women from all walks of life who share their testimonies of what God is doing in their lives. And of course, to encourage you to take steps in the right direction.
Hello viewers, welcome back. Pharmacist Salamatu Orakwelu is still with us and we have been discussing the misuse of medicines. Thank you for all this knowledge. I wish I could keep you here for a very long time. We're just starting. There's a lot to talk about because I'm learning a lot, honestly. Okay, so we have talked about the duration, and then the frequency. And sometimes some patients don't ask questions because they think they know, they give you a new medication, they just assume it's the same thing. So your advice is ask questions.
Ask questions.
You might not know.
And don't just ask. There are some questions you ask, and if you're not satisfied, ask.
Ask again.
Ask and be sure you understand.
You understand.
Some people even go to the extent of writing. Like I told you, there are ethics of labeling. When you were talking about this issue of writing stroke, I just started laughing. I had an indigent patient that came. Then I was still in school, still working while in school, go to pharmacy in Kano then, and a man came. Is it a man or a lady? Came anemic. And Jawaron then bought a bottle. And the bottle was actually supposed to last her for like 2 weeks, because it's 200 mils. She was to take 30. I gave her 2 bottles. She was to take 30 meals daily. That's 10 meals in the morning and in the evening. She was to take it. And within 2 days, she came back. And we said, what happened? She said the drug is finished. And after, when she took it, yes, it also has its own side effects. And when she came back, we now asked her what the problem was. She said she has finished it and that she has stool is black. So yes, because of the iron content there, she needed to be educated. When you're taking iron, it's still parts of the excretory, the metabolism process, the metabolism and the excretion. Some drugs are excreted in the urine. That's why you find that when you take some certain antibiotics,
it starts to persist the smell,
and then some through the physics, some even sweat.
Where
the skin is also an organ of excretion. So, and she now says she has finished. She now says you finished. Yes, now she was taking 11 of the cover. They say 11 in the morning, 11 at night.
Oh no!
It's 1
because of the 1. Oh no!
So it's like taking 11, and the cover is 10 meals. So she was taking 20 in the morning. 20. That's 20.
22.
Yes, and the thing within 2 days finished. The 200. That's the 400 meals that she was given.
Oh no.
She was counting 11.
11.
One,
Oh no.
So it's always good to write it. Write in words, not just assume that the patient now understands. And again, this issue of educating a patient, there are some patients we even being literate. You know, there are some suppository. Most suppository have an inner cover. It's sealed around it. And an elderly man was prescribed oculars. And they called me and told me that they gave them, and it was supposed to like ease constipation. And said they all through the night he didn't sleep and he did not go to toilet. He's even having pain in his sac. And I say, yes, they said they just removed they just tore the edge. I said, did you peel out anything? He said, and they said, no, they didn't peel anything out. They just inserted it. So it's like carrying, how will I even put it? A shell of granite and swallowing it. Granite with the shell inside. The shell inside. You're supposed to open the shell, break the shell, then eat the nut.
So it won't even do anything. Oh.
So you don't assume.
You don't assume. You must ask questions.
You just don't assume. Wow. And you need to be detailed in labeling and also counseling.
Okay, that's the pharmacist. So let's talk about the anti-malaria and antibiotics, because this one, I don't know why I'm just how do I keep going to antibiotics and anti-malaria? So what's the problem? What are we doing wrong with antibiotics and anti-malaria? I know we'll talk about anti-malaria when we're talking about
when you talk about
vitamin C.
We're still going through the line of this issue of misuse,
the
misuse of antibiotics.
Okay.
You see, we use this issue of using this sledgehammer in trying to like kill a fly. You understand? You're looking for, I have, they said there's a cockroach in here. You go and look for a gun. That you're looking for that gun. You're going to use the gun to kill the cockroach. That is what most people do. Look for the bigger antibiotics to start using. And it still takes us back to the basis. Get your diagnosis right. Go to the hospital. See a physician. See a physician, get your prescription, go to the pharmacy, get your drug, get it refilled. And I just know we're making progress.
Okay.
I can speak for Abuja here for ethical practice. But out there, you
can't even tell.
You don't just, because you're seeing a consultant, you're seeing a physician separately, you have a designated pharmacy where you go to get your prescription filled. Unlike now, you know, when at that initial stage when we're discussing issue of abuse, I talked about the environmental factor, accessibility. In the market, people hawking drugs, storage condition, you understand?
Yes.
Drugs are supposed to be, like for Tamuleba drug. Tamuleba drugs are drugs that are heat sensitive. You're supposed to put them in a free refrigerator. You see them carrying it under the sun. The integrity of the drug is already compromised.
So you're not even buying from them.
You're taking placebo.
Whoa.
Placebo is
just doesn't do anything.
And people feel I've been spending money, I've been taking drugs. You know, there are some people that will just go, okay, you are Igbo now, quorum or just mix me. You find out
mix is one.
There will be ampiclox, there will be tetracycline, there will be those days that there are chloramphenicol, there will be folic acid, there will be fesolate, there will be ibuprofen, and they will give you this. After taking it, you see yourself sweating. And when you feel
yes, that's the thing. When you start to say, yes, the thing is working, then I'm feeling the whole thing come out of my body. You don't know you're actually...
If you're doing yourself a very great harm.
Wow.
You're doing yourself a very great harm. So in terms of even this education, you understand, we need to get it to the grassroots, the indigent ones. And that's where issue of primary health care in most rural area is actually important.
So the antibiotics, isn't it? I think in some countries it's not even an over-the-counter. Here it looks. I don't think it's even an over-the-counter drug here.
Antibiotics is not an over-the-counter
drug here.
And that's why I said that. I can speak for Abuja, and we're even taking it out. The pharmacists Council of Nigeria has actually been strict and closing up in most of these patent dealers that are dealing on non-ethical drug. They are ethical products. They are not supposed to be sold over the counter. But you see, there are a lot that goes on here. The legislative aspect of it, legislation of most of these laws are not really enforced.
Okay, that's beautiful. So the thing with this, we have abused it because we don't even take it appropriately. So whatever bacteria you're trying to fight,
you're creating
resistance. So they're now having a field day in your house.
One, if you don't take it, it's like pouring water on a stone. You see, that's why we cannot overemphasize issue of getting the right diagnosis. And you see, that's why most times cultures are carried out. If you're sick, you go to the hospital. They could do give you an empirical treatment based on the symptoms that you have, but they are usually cultural and sensitivity drug tests that are done so that the organism, the right antibiotic will be used to target the organism. It might be will I say you say put together is okay, I've gone to this hospital, the price is expensive, their fee is expensive, but if you put together the process, what they are doing, the stages they go, you see a physician, samples are collected, they're doing a culture to be sure that the right antibiotic is targeted to the organism, so that at the end of the day you get the right therapeutic outcome. The outcome will be okay. The patient will be fine, and the number of stay in the hospital, the number of stay out of work, is even lessened. It's lessened. People just go. I had this stomach upset last time. I think the doctor gave me a particular antibiotic. It's the same symptom I'm having.
Now I'm going to take it again.
Just go, because we have access to buying drug anywhere. We just go buy it, repeat it, and at the end of the day, you might get a temporary relief. But are you targeting the organism? Because you're not targeting the organism, you are not creating resistance. That the next time you actually need that drug, you to no longer. Resistance comes in when you don't adhere to therapy. You don't take the drug at the right time, like I've already pointed out. You understand? And you take an underdose. So sometimes we're not talking about right drug, right patient, right drug, right patient, right dose, right duration, even the timing, the frequency.
Okay, like I can't remember the pharmacist I was speaking with, and she said, you need to maintain an optimal amount for antibiotics, because bacteria are very funny. Listen, they're quick to get resistance. When it's just like an army, or somebody. Just imagine an army protecting himself, and then you do something. You don't expect them to expose themselves.
Talking about bacteria, what they target their cell, or they build a shield
around themselves, to protect themselves.
And so by the time you take suboptimal dose, you are not doing anything. You are not doing anything to that bacteria. So taking that's why I talk about the right dose, the right drug, the right patient, the right frequency, and the right duration. You could start an antibiotic, the right dose, the right frequency. What about the duration? Because you've been told to take this drug for 10 days, you've taken for 5 days, you're feeling
good, and
you stop. You've not done yourself.
And that cuts across every other medication as well. If you're to take it for a number of days, even if you feel better, continue until
you have to complete it. You have to, if you don't complete it, it's misuse.
So if you don't complete your medication, you're misusing. If you don't take
the right
drug, you're misusing. If you don't take the right dosage, you're misusing. Okay. So it's not just the misusing is, which means almost everybody misuses. Almost everybody misuses, because that's
why I say for abuse, that person goes with the intention of feeling high. You have your reason why you want to abuse this particular drug. You're under stress. You want to sleep, and from getting yourself off that, addiction sets in. There are some people that And you know, ironically, you still use the same drug to help this patient out of the addiction.
Okay.
Yes.
Oh, all right. Okay, then you give them the what they call that thing now that doesn't do anything, but
no, not placebo.
Okay, not the placebo. Okay.
You don't take them. You don't take it off them. There's this withdrawal syndrome.
Okay.
That
Okay.
comes in.
Okay.
That sets in.
Okay.
Yes.
Okay. All right. Anti-malaria and vitamin C.
Okay.
We are not supposed to. Well, it's not. I thought it was popular information. I thought everybody knew about that. But now, what's the problem with anti-malaria and vitamin C? Because sometimes if you tell people what exactly it is, then maybe they can say, okay, and is it vitamin C, the tablet, or both vitamin C and the food containing vitamin C, like oranges, mangoes?
You know, people will say, okay, those days of our parents will go to the hospital, they'll give us vitamin C.
Yes.
And you know, now we use ACT.
Okay.
And what is ACT? Centimeter combination therapy.
Yeah.
So you see, because of that lumefantrine that is there, you see, malaria itself is released into the bloodstream, attacking the blood cells. And once you take this anti-malaria, they are released like free radicals. What is vitamin C? Vitamin C is an antioxidant.
Okay.
That goes to mop up free radicals in the body. So the vitamin C recognizes this anti-malaria as free radicals. Goes to mop it up.
Them up.
You now find out that I just finished treating malaria and I'm not getting better. Is it that the physician does not know what he's doing, or is it that the drug I bought is fake? Is it that I did not take it? And are you getting me?
Yes.
So that is basically.
And then you ask your friend, which one? They say the one I took is better, but you don't know the problem is actually.
And again, you see, to be able to reduce the parasite level, there is a duration. You have to. The timing is also important. It's a cycle. You're trying to like cut a cycle, so that you're closing up on the bacteria that is in the system. To be able to reduce the parasite level for most ACTs, especially the artemether lumefantrine combination. Once you start at 0 hour. After 8 hours, that 8 hours is very important. Why? You want to increase, the concentration of the anti-malaria, so that
you can stop that
cycle. You want to be aggressive at that particular point. And after that 0 hour, the next one is going to be 24 hours. 24 hours, you have 36 hours. What I usually tell my patient, I do it in such a time that it will be convenient. You find out that after that 0 hours, you have a fixed time, that 8 hours. I tell some the best timing so that it will go around. I tell, do you sleep early? If you don't sleep early, if you can keep awake till 10 at night, you know, if you take at 10, the next 8 hours will be 6 a.m.
Yeah.
So the next time you're going to take will be 10 p.m. And after then, it's going to be 12 hourly. So you start 0 hour will be 10 p.m. Then the 8 hours will be 6 a.m. Then you now go to 10 p.m. the next day. It will now be 10 a.m. 10 p.m. until you're done with this.
Yeah.
Then except for those that you are taking, there are some for those that are the other combination that with peperaquine. Those ones is just a daily dose. But you need to keep to, since it's the daily dose, 24 hours, keep to the timing also, because it's a cycle.
It's a cycle. Okay. Now I like that, because that's explaining. So anti-malaria, the free radicals, because vitamin C is act as free radicals. The antioxidant. So they take out the mop of the
free radicals that are in the body. That this drug has been released as free radicals in the body to fight against the malaria parasite that is in the bloodstream. And vitamin C recognizes the drug as a free radical, so mops it up. So 3 days of being off. And the vitamin C is not just, we know you have a lot, there are vegetables that are rich in vitamin C's. This zogale you see is very high in vitamin C. We take orange, we take pineapple, we take apple, even watermelon. We have a lot of fruits that are rich in vitamin C. So when we talk about vitamin C, we're not just talking about even the this little one we take, the vitamin C 100 milligram, is not even where the emphasis is. But 3 days being off this food and medicine will not do you harm, but rather
you're not doing for those 3 days to get your treatment, and when you're done,
and again, issue of it now brings us to issue of when you're trying to ask question of interaction, issue of milk and certain drug. There are drugs that when you take them with milk, they form a complex. They call it chelating. They call it chelate. Yes, you understand. Once that complex is formed, it reduces the efficacy of that particular drug for iron. Iron and milk, they don't go together. Iron and antacid. And what is the content that is there is calcium. The calcium in milk, and also the one in other, you take it with iron containing products, like all this blood tonic. You take it, definitely you find out that the duration the drug is supposed to, like, that's why I find out as people, when they take it, they get constipated. Digestion is inhibited. The drug is not absorbed from the body.
That's with milk. That's with milk and
iron
containing.
Yes.
Yes,
not just only that, there are even other ones. There's this cheese phenomenon they talk about when you take it with some other drug. So you see, and there's other drug, if you're on a blood thinner and you use it with, that's why when we're talking about drug food interaction, like warfarin is a blood thinner. You understand, for people with we'll not go deep into that one. But if you take it with ginger, you potentiate, we talk about inhibition and potentiation. You potentiate the effect. You're thinning the blood to get to a point the person will start bleeding, and one will not be able to control it.
I think that is all we can take today. There's a whole lot. I think you need to come back, because there's some things I want to talk about, but I can't talk about it now because of the time we have. We're already out of time today. But you see, that's the thing, because the discussion has been so interesting. But thank you so much for coming, because I've also learned a lot. I think when I get home today, I need to talk to a lot of people so that their heads can sit properly on that discussion. But thank you so much.
The issue of misuse of drug cannot be overemphasized, because we need to take is when you're healthy that you'll be productive.
So I'll bring you back again. Let's continue this discussion. We have to conclude some things on this discussion.
No problem.
Yes. Thank you so much for coming on the program. Thank you so much.
We're just discussing and you also chipping in yours.
Thank you so much. Thank you so much. Thank you so much, viewers, for staying with us. For the past couple of minutes, I've been speaking with pharmacist Salamatu Orakwelu. She has told us a whole lot, and I learned a lot today, and I believe you did. She's a fellow of the West African Postgraduate College of Pharmacists, and she is also the chief pharmacist at Chiva Specialist and Urology Center here in Abuja in Zone 3. And we have learned so much from her today. Please, one thing I would like you to take away is ask questions. Ask questions. Very, very important. Don't assume. Don't even believe what you were told before. Ask again. Things may have changed. Just ask again. Thank you so much for joining us. I'm Angela Wednesday. I'll see you next time. Bye.
Bye.